Okay, today I'm going to talk about this topic, and I think it's very important for cardiologists if you're going to do complex PCI in terms of getting good long-term results and minimize complications. You actually need to understand what's happening in the world of imaging. So let me just try to give you some basics, then you'll understand what's the difference between a standard CT and a photon counting CT. So in a standard dual source CT, you get about 4 rotations per second and 1,000 projections per rotation, which means that each projection takes about 250 nanoseconds, all right? And therefore, with one projection, you get about 30,000 X-ray photons arriving at a single detector. And you have 30,000 arriving at a single detector, and the detector needs 8 nanoseconds to collect and measure the intensity of each photon before the next photon comes. Now, even you get the fastest photon detector, the X-ray photon detector, you can't measure all this fast enough. So in a way, you use a technique to weight the average intensity of the photon. So you cannot really individually measure the photons by itself. So you lose some characterization of the material. So in a standard CT, as I say, what happens is where the X-ray photons will hit what we call the scintillator, and then these are called energy integrating detectors, EID for short, all right? And this converts the X-rays into light. So you need to convert the X-rays to light, to visible light, and then this is then detected by what we call the photodiodes, which then convert this into electronic signals. And actually this is digitized. So it may be difficult for you to understand, but it's like you have the entire image in a block, in an entire block of digitized mathematical signals. All right, and then after that, you can chop it in different ways and different directions to actually get the image in a 3D fashion. So what's a photon counting CT? Now, it's usually a totally different concept. So they take away the septae, and they use a different kind of crystal, which is a cadmium crystal. And what it does is that it actually, the X-ray photons directly go into this detector, and then there are two, you see there, they apply a current of 8 to 1,000 volts, and you have a cathode on top and an anode below. And when this X-ray photons hit this detector, you generate electron pairs, of which the positive one will go to the cathode and the negative electron pairs will go to the anodes. And this will again do the same thing, create the electric signals. Now, the difference between this and the earlier one is, number one, you measure every single photon. So you find that photons of low energy, photons of high energy, you measure it. So you can actually quantitate it. And then all this by electrical signals will actually become like an algorithm, like a digitized model, which again, you can cut in various thickness and all that. So this is a difference. It looks fairly complicated, but if you look at I don't know where to point here. If you look at this, so what happens is that this will then go in what we call energy bins, because it measures all the different photons, and so photons of different energy are then compartmentalized into different energy beams, and therefore you can do what we call spectral CT imaging, all right? And later we'll talk a little bit about spectral CT imaging. So you can give more characterization to the images that you actually get. Now, so because you have different levels of, you can measure the weaker photons, stronger photons, etc., you can decide by adjusting your energy threshold in which you want to measure to cut off what we call streaking artifacts, which you see in some of the CTs. So you can say, I want to set that, knock off all photon energies at maybe 20 to 65 keV, then you can knock that off. So you can actually, later on, you will see, I will talk about the different convolution algorithms and kernels, which you can adjust to make all these adjustments. So this is all the benefits of photon. You get less electronic noise, you get a better iodine contrast, increased spatial resolution. So later you will see the spatial resolution is up to 0.1 mm. So that's amazing, 0.1 mm. Standard CT, you're looking at best, even the best machines now, you're looking at 0.5, 0.6 mm, all right? And you will see that you don't get this problem of metal artifact or beam hardening artifact. So beam hardening metal artifacts are areas where you get hypodensity because of the beam, or you get blooming artifacts because of reflection of the X-rays, all right? And because this is, you measure the photons of different energy, so you can actually adjust the energy thresholds and see what you want to do with it. And you can do very low contrast scan with spectral CT imaging. So in the past, you will say that, okay, if this person has a renal impairment, kidney creatinine is high, I will not scan. Now you can scan do a CT with very low level contrast, like 20 mLs of contrast, which, you know, in most moderately or mildly impaired kidney patients, you won't really have an issue with that. Okay, so this is just to tell you that I've always been interested in this, and I've been, I said earlier on that I'm a little bit different because in addition to cardiology, I trained in interventional radiology as well. And so in 2005, we did a small study on CT-guided PCI, and we published, I think this is the first paper in the world on CT-guided PCI. And, you know, it convinced me that first, you can do complicated cases with good long-term outcomes and safely. So that's, since then, I've always believed that for every case that I intend to do a procedure, I will do a CT first. And in the real world practice, I find that I don't need to do any diagnostic angiogram. So I hardly ever do a diagnostic invasive angiogram for the sake of doing an angiogram. Okay, so now, the photon counting CT is a little bit more complicated than the standard CT. Standard CT, you take a picture, that's it, all the images there, then you print it out and you sort of like, you know, give it to the radiologist who will report it, or the cardiologist, whatever. But because the photon counting CT has many features, so you need to be able to know how to use it well. So generally, you can divide it in two modes, all right, two modes. One is what we call the standard resolution mode, SRM, where you can do spectral CT imaging by, you know, changing the energy threshold. Or the other one is 0.2 mm scan, which is called the ultra high resolution mode. So just now, as I said, the spectral CT, which you can do with the standard resolution mode, by adjusting the levels of the energy, and you can actually improve the contrast to noise ratio, reduce contrast media injected. I give you a real example, so maybe you can understand. So I had a family that brought a daughter along, and the daughter was vaping. The daughter is 20 years old, but she vapes every day for 2 years. And the parents wanted the daughter to stop vaping. You know, vaping electronic cigarettes, right? So I think now a lot of young women, very fashionable, they use these electronic cigarettes. So the parent says, hey, doc, you know what to do? You know, this, my daughter is vaping, you know, every single day for the last 2 years. I wanted to stop, but, you know, so you know what we did? I did a CT lung. And you know what's the radiation dose of a CT lung using spectral CT scanning? Radiation dose is 2 chest x-rays. That's it. I showed her that she's already got N5C matrix changes. And straight away she says, doc, I'm clear, I'm not going to smoke anymore. I'm not going to vape anymore. So you can do things that in the past we would never think of doing. We would never subject a 20-year-old lady to a CT scan because of the rate. But today, because of the technology, it's amazing, you know. Okay, so just to give you some sense of this, so the blue ones are the ones in the same patient on different dates. Just to show you the comparison, the blue ones are what we call the standard CT images, and this one is what we call the standard resolution mode using the photon. And obviously you can see that the edges are really much clearer. There's no more fuzziness, all right? There's no more fuzziness, all right? So you can see the difference. And of course, when you do complex PCI, you will end up with a lot of issues, you know. And calcium is always a big problem. Too much calcium, rotablation, no reflow, wire get trapped, you perforate, you dissect, and all sorts of complications. So one of the things that we want to do is know how is the calcium like before we go and do the procedure. So let's look at photon counting CT and calcification. So these are images produced from the photon CT. Okay, so like I said earlier, you'll find that calcium blooming and metal artifacts are caused by volume averaging, motion, beam hardening effects. But with photon counting CT, you can avoid most of this. So I'll give you another example here. So this is a scan with a SRM mode, 0.4 mm slice thickness, and we use what we call a smooth vascular kernel. Kernels are convolution algorithms used to actually for you to tune. They're a little bit like when you take a picture, you use different filters. So this is something like a filter, all right? And you can see obviously that the calcium, if you see on the standard image, you look at it, you would think that, wow, this is going to block the whole artery. But when you look at it on a photon CT, you look, whoa, this is different. You see? So it certainly makes the way you approach the patient differently. You also avoid unnecessary coronary angiograms as well. So these more pictures. Again, you can see the calcium here and the calcium here. So obviously you can see that the difference and how sharp and clear the images are. All right. Another example again, you see, you would have thought on the left that wow, it's got significant block, but actually not really. All right, because the photon CT can show you. And if you do a cross section, you look at the top one, you would think that, wow, this is really bad. I think definitely need a PCI, severe stenosis. But you look at the bottom, not really. A lot of it is actually what we call positive remodeling, the calcium protruding outside the vessel. So you get a better sense of what the situation is. Similarly for this as well, right? For this as well. Okay, so here now, so after you've gotten the image, there are two things that are important. So remember just now I told you, when you collect the information, it's like a digitized whole block of image. And therefore, with the software, you can actually decide to cut it in various slice thickness. So for example, you could cut it to 0.4 or 0.2. So you can see that 0.2, obviously the calcium, you can see better. And then you see on top the word kernel, so 64, 48, 64. So 48 is a smooth kernel, and then 64 is a sharper kernel. So you can actually tune it. And after a while, when you use the machine, you know what the settings to set it at. And then the nice thing about spectral imaging is that, wow, okay, the calcium is blocking my artery. How severe is stenosis? What if I take out the calcium? So with the software, this software is called Pure Lumen. I can remove the calcium from the vessel. So now you can see the vessel much, much better. All right? Okay? Much better now. Okay, so how about stents? So, so by the way, before I leave calcium, so even if the calcium is in the thousands, when you talk to the radiologist, they tell you, oh, beyond 400, you can't scan because images are not clear, whatever. But actually, even if it's 1,000, 2,000, 3,000, 4,000, no problem. But you need to set it correctly. Then you can do a scan and still see clearly, even if the calcium score is, a few thousand. Stents. So there are many publications on stents as well. How stents can be seen better with a photon counting CT, including in-stent stenosis. Here you can see, all right, and then I won't go through the details of this study, just to tell you that all these studies tell you the same story, that you can get better resolution of coronary stents, all right. So just to give you an example, so this is a stent, a long stent, all right. So you can see that from the same image, we can reconstruct from 0.8 mm resolution to 0.2 mm resolution. And you can see that with 0.8, it's very smooth, but a bit fuzzy. And then I just thought I mentioned 48 is a smooth kernel. As we go up here, the kernel is a higher kernel. So you got a sharper convolution algorithm with a slides, so you can see the stent quite clearly, all right? So in photon CT, it's not like the standard CT where you scan and then that's it. You need to know how to adjust the settings as well. So just to tell you that a lot of doctors tell you that, oh, if there's a stent, sorry, you can't do a CT, you cannot see clearly. But I want to show you here that even if you have a stent, you can see it clearly. So I just go through different stents. So this is a cobalt chromium alloy stent called angiolite. You can see the stents very clearly and the part in the stent. Excimer stent, also a cobalt chromium alloy. And you can see very clearly, you can see the pictures are very good. Synergy is a platinum chromium alloy. You can also see it quite clearly as well, all right? And this is a Synergy Megatron. So this one's a left main. And there's an overlap. So there are 2 layers of stents here. But even with the 2-layer stent, you can still see clearly, all right? And this one is a Create 8 Evo, a cobalt chromium, but you see the design is a little bit more complicated. But even then, you get also quite good pictures. And by the way, you see there's a dot here. That was an old BVS marker. And you don't really see much in terms of artifacts from the BVS marker as well. And IVUS correlation. So this is a patient we did recently. This is the actual IVUS pictures. And actually, you can see the pictures do correlate. And here you can see the loss in signal, okay, because of the calcium, which is the same as here, all right. And then, so as I said, for photon counting CT, you want to know whether, okay, is this a long or short segment? Is it soft? And then where's the calcium? Is it on the side or is it stuck in the middle? If it's a stented segment, same thing, you can get more information. So whether it be a stent or whether no stents, for CTO, it actually provides very useful information. Bypass graphs as well. So you can see the pictures are all very clear, easy to see. So you can use it also if you have to do bypass graph stenting as well. Okay, so I don't want to go through all the details, but there's a whole list of cardiovascular applications of this. But all I want to say is that for those of you who are not familiar, I think it's good to understand this because this will become a very important tool for us as cardiologists doing complex cases. Thank you very much. Thank you.